Hello, everyone, and welcome to the webinar, Understanding Coronavirus. My name is Katie Baker, and I will be your moderator today. I'm the marketing manager at Citron Hygiene, and I'm excited to be hosting this session. I'm pleased to introduce you today to today's speaker, Dr. Sumontra Chakrabarti. Suman is a fellow at the Royal College of Physicians of Canada and an expert in tropical medicine and hygiene. He is currently working at Mississauga Hospital as the division head of infectious diseases and a site lead for the internal medicine clerkship. Before I hand over the mic to Suman, I have a few housekeeping items to cover about this presentation and the Zoom webinar platform. First, today's webinar will be available on demand after the live session and is accessible through the same link you're using now. And next, we'd love to hear from you during today's presentation. So if you have any questions for our speaker, please feel free to send it through by clicking the Q&A icon on the bottom center of the screen and type in your questions, and he will do his best to answer all of them at the end of the webinar. For those of you that have submitted questions ahead of time, those will be answered throughout the presentation. If we don't get to your questions during today's webinar, we will be sure to follow up afterwards. So without any further ado, I'd like to kick things off by welcoming Dr. Sumontra Chakrabarti. So Suman, over to you.
Thank you, Katie. Thanks so much for having me. It's an honor to be here today. This is one of my first times doing a webinar, so hopefully this goes smoothly, but I have a lot of help around me. So once again, thanks for having me. There's a picture of me. I work with Trillium. So this is going to be a fairly simple type of thing that obviously we're all interested in learning more about coronavirus. So we'll talk about some frequently asked questions that I get. And, you know, I'm a clinician. I work with patients, so I can give the more information around that, that stuff. But the other things is in terms of hand hygiene and infection prevention and control, I can also give a little bit of insight there. And at the end, of course, we'll have time to go through questions. I have no disclosures, no conflicts of interest. So let's start off right at the very basics. What exactly is a coronavirus? So here is an electron microscope picture of it. It's a bit stylized, but that's generally what it looks like. So it's a virus that affects both humans and animals. And there's about 7 types that can affect humans. And one thing that's really important to note is that we have coronaviruses here in Canada. If anybody in this room, which is essentially all of us, if you've had a cold, you've had a coronavirus in your life. So coronavirus is actually, at least the common ones, are the cause of the common cold. But we've had a couple of other coronaviruses that have popped up since 2003. So I'm sure everybody here is familiar with SARS. So that was a special coronavirus. There's one that was coming from the Middle East. It originated there. That was the MERS coronavirus. And now, of course, we have the one that was initially called the novel coronavirus, but the official name of it is, you can see in the bottom there, SARS-CoV-2. In my mind, it's a bit of a confusing name, but that's the name that's been officially given. So that brings us to the next question. Can you please clarify the exact name of the virus and what are we seeing? What are these names we keep seeing? So the official name of the virus that was given just a couple of weeks ago was SARS-CoV-2, or Severe Acute Respiratory Syndrome Virus, coronavirus number 2. And you've also probably seen this name called COVID-19. That's Coronavirus Disease 2019. So COVID-19 refers to the illness that's caused by SARS-CoV-2, okay? In my experience, I've done a lot of media for this. COVID-19 is kind of the name that is being given for both the name of the virus as well as the illness, but officially those are the definitions, okay? That's what these mean. So how did this outbreak come to be? So in 2019, December, we started noticing that there were, not we, but the Chinese doctors in certain hospitals in Wuhan started noticing that there were an increasing number of people with an otherwise unidentified pneumonia. And to be honest, this kind of thing happens in Canada too. All of a sudden, you start to see people coming into the ICUs with pneumonias. Most of the time, this ends up being influenza. Okay, and that's actually what it was thought to be, but they were thinking, well, we're not really in the influenza season yet. But lots of people were found to have worked in a wet seafood and livestock market. So these are markets that have both live seafood that you can purchase, but in this particular market, you could also purchase other things, such as bats. There are certain types of small rodents and things. And based on this pattern, they were thinking this was some type of viral cause. And the top three things that we were thinking at the time was SARS, MERS, and influenza. And again, influenza, the new strains of it are very, very common to come out of certain areas of China. Okay, just to give a bit of geography here, here's a map of China. That's the first circle there, that's Beijing. And Wuhan, where we were talking about this outbreak, is down here. So it's in the eastern part of China, okay? And this is a very, very densely populated part of the world. And, you know, Wuhan by itself is 11 million people, and it's not even the largest city in China. So this is what I mean by unidentified pneumonia. So this is a chest x-ray. So the chest x-ray on the left is normal, okay? That thing in the center that's kind of moving a bit to that glob on the left, that's your heart. And then on each side, that's the lungs. The lungs should be mainly that dark black color. You can see some vessels in there. But on the right side, the right side, I'm sorry, I'm so used to looking at chest x-rays. But that side is a person that has some type of pneumonia. You can see all this white stuff on both sides. That's pneumonia. And this can be caused from multiple different things. It can be viruses, it can be bacteria. But a lot of this type of thing was presenting in the hospitals in Wuhan. So there were some initial reports that people were worried, well, is the Chinese government suppressing things? Well, to be honest, right from the get-go, when they did eventually figure out there was a problem, they were very, very open, and they shared all their information with us. And what they found in early January was that this was, in fact, a coronavirus, but it was a new one. It was a novel one. It was not one that was previously identified. And all this information was shared right away. And because of this, countries like South Korea, Singapore, Taiwan, they were all able to identify their cases very quickly. So it wasn't completely clear until about mid-January where person-to-person spread was then proven, and it was highly suspected, and they were already basing their infection control practices if it was, but this was then confirmed. And on the 23rd of January, the biggest quarantine in human history was launched in Wuhan. So this is a picture of one of the busiest highways leading into Wuhan, and it's essentially completely deserted. And this is something that is remarkable when you consider how big the population is there. We've now had about 10 cases in Canada, and the first case was identified here on January the 25th at Sunnybrook Hospital. So far, very fortunately, all 10 cases have been mild. Okay, so why is everybody so worried about the current outbreak? So of course, one of the big things is that, number one, the SARS outbreak, memories from Toronto in 2003 was a pretty big deal. And this is a SARS-type virus, so of course everybody's concerned. Also from the beginning, there are a couple of framing things. So this was already framed as a SARS-like illness. So that kind of put everybody on their heels. And then we started seeing fast human-to-human spread. We were seeing virulent cases in China. And of course, the big difference between now and 2003 is that we have social media. So right now, I'm following this certain a Twitter account where basically they give you updates when every single case is announced. So when you're starting to get this kind of like every minute-to-minute data, it does feel a lot worse than it actually is. I'm not saying we shouldn't take this seriously, but the thing is that there is a lot of hype around it that wasn't there in 2003. This gentleman that is pictured here is Dr. Don Lowe. He unfortunately passed away a couple of years ago, but he was the head of the efforts in Toronto to curb this. And a lot of what he sort of directed back then are the practices that we're using in Toronto and in Canada today. Okay, so what happens to somebody who gets infected with SARS-CoV or gets COVID-19? So here's something that I picked up from the CDC. So these are all sort of symptoms. If you look at them, they're all things that many of us have had at some point. So maybe not the breathing difficulties and the pneumonia or kidney failure, but most people get just a viral type of thing with, fever, cough, sore throat, a little bit of shortness of breath. If you have asthma, your asthma gets a bit worse. And this is how most people initially present, okay? And if you pass this to somebody else, they can present the same way. Okay, and in more severe situations, you can get really bad pneumonia, like that diagram that I showed you, and then you can get things like sepsis, kidney failure, but those things are very, very rare in terms of the overall picture. I shouldn't say rare, much less common in the overall picture. The initial symptoms are very similar to anything like the cold or a flu, and 80%, maybe even 85% of people get just that and they recover. But kind of people that are older, they have more chronic diseases, lung disease, you start to get progressive shortness of breath over the next couple of days. Then you can get severe pneumonia and you can die. Okay, but one other thing that I do want to mention is that in the early parts of the outbreak, only the more severe cases were being highlighted. So that's important because while obviously we have to be concerned about the severe cases, it gives you this feeling that everybody who gets it gets sick. But once you start to get more and more cases and you start to get a better idea of what I call the rest of the iceberg, you'll start to see that there are lots of people who have very mild cases and they get better. And that's actually what we had here in Canada. Our first 10 cases have been people that have been mildly ill. We tested them, they have coronavirus, but they didn't even need hospitalization. They could be at home and they could stay home and quarantine there. Okay, so how contagious is this virus? This virus is contagious. So I want to draw your attention. I'm sure you guys have all seen something like this. So if you look at the red ones, that's airborne spread, and then droplets are the ones that are in blue. And droplets are the ones that we need to worry about with COVID-19. And this is the same as influenza. So these are droplets that come out of your mouth or nose when you cough or sneeze. The large ones go about 1 to 3 feet, and the small ones go as far as about 5 feet. So in general, it's about 3 feet. If you're next to somebody, you're coughing and sneezing, you can then pass to them. The red droplets are the airborne ones. So that's, for example, if I'm sitting in a room and somebody is sitting across the room from me, like meters away, or somebody comes into the room several hours later, you can pass that to them. That does not apply to SARS-CoV as far as we know. This applies to diseases like measles and tuberculosis, which so far, based on the data we have, this is not how COVID-19 spreads. So keep in mind just the blue dots here. Okay, so a comparable virus is influenza. So influenza spreads this way. It's spread through respiratory secretions. There's nasal, sneezing and coughing are the big ones. You have this initial incubation period, and the incubation period is defined as the first point at which you are exposed to the virus to when you start to develop symptoms. Now, you've probably seen reports, people are saying, oh, well, the incubation period can be up to 28 days, 21. When you look at the large amount of data that we're collecting, it looks to be anywhere between about 7 to 10 days, okay? And this is based on thousands of observations. And this is part of the reason why you're seeing quarantines are 14 days, because you want to give yourself a buffer period. There's also a big question is if you don't have symptoms, can you spread the virus? It is true that people that have minimal symptoms can spread the virus, but it's also looking like the initial data coming out of China is that these people are a small minority of what's actually the main cause, and that is people who are coughing and sneezing. Because if you think about it, when you're coughing and sneezing, you're spraying droplets everywhere. That's the much more common way that you can get spread. So what is the current global burden of disease? So for those of you who have seen this dashboard, this is from Johns Hopkins University. This is actually, I have to make a disclaimer here, this is 2 days old, so it's a little bit more than this. So there's about 80,000 cases in China and just over 80,000 cases in the world, 81,000. So the deaths is, let's just say about 2,600, 2,700. And you can see the green thing is that you're getting a lot of people that are recovering from this. And the latest data, you're getting people that, the number is over 30,000, over 30,000 people recovering. So lots and lots of people are recovering from it. It's really important. I want to show you something. We've been obviously hearing lots about this being around the world. There's lots of cases in Italy, in Iran. You're hearing cases popping all over Europe. But I want to show you this graph. And this graph still applies to today. 99% of the cases are still in China, okay? And if you look at the deaths, we have roughly 2,700 deaths in China, and the rest of the world maybe 40. So that's huge. I'm not saying that's going to be like that the whole time, but it just kind of puts into perspective. Lots of people are thinking that already we're having rampant deaths around the world. That's not the case. And the spread of this around the world may not be the same as in China, given differences in population density, the fact that already many countries, including Canada, have preventative ways of trying to curb the outbreak. But it is true that the outbreak is now past containment. It's now outside of China, and the efforts are not looking at containing the virus, it's looking at trying to mitigate its spread, and that's something that is definitely possible. So this then leads me to China. Why does China have so many cases? And this is a big thing having to do with what we're seeing in this picture here. So the top picture is a picture of one of the busiest places in Wuhan, which, so you can see how crowded it is. For those of you here who've ever been to a really crowded country like China and India, you can see a crowd like this and then drive 20 minutes straight and still see this crowd, kilometers away. And it's really important to note just how crowded these places are. The bottom is the Diamond Princess cruise ship, and you remember that this is a cruise ship that had all these cases in Japan. And one of the things that these two places have in common is crowding. And we do definitely think that while we can spread droplets, crowding can enhance the spread. And that's part of the reason. There are some other reasons too. So of course, we have an extremely high population density in Wuhan. Wuhan's about 11 million people, and it's not even the top 5 most populous cities in China. Wuhan's also a transportation hub, so all of the main rail lines, subways, these go through Wuhan. And the other thing too is that what was very similar, as you saw in the swine flu back in 2009, by the time you are detecting cases at the epicenter, you've already seen that this is exploding around. You're probably already in the area where you're in the exponential spread, in the accelerating spread. So that's part of the reason why we're seeing so many cases in China. The other really important thing is, why are we seeing this in China? So there is a very big thing in China. We have a big population density, and you have a lot of animals as well. And you can see that certain viruses, especially influenza, the genetic material from the viruses can kind of go back and forth between humans and animals and cause mutations. And this is why we see different viruses often popping up in this part of the world. All right, this was a big question that I get. Maybe it's not as topical now, but what about that big bump in 15,000 cases that was seen on February the 13th? Okay, so take a look at that bottom right graph there. You can see the cases were kind of increasing. They were leveling off, and all of a sudden you get this jump. The reason this jump happened is that China was obviously getting overwhelmed with the cases, and you couldn't just rely on swabbing people. There's a special swab that we do that can identify coronavirus. So what they were then doing is, okay, look, we can't get all the swab, so we're going to also include people who are presented to the hospital with fever and pneumonia, or people who have a positive CT scan showing, CAT scan it's called, showing that type of pneumonia. Okay, so once they added that, you were all of a sudden capturing many, many more people, some of whom may not even had coronavirus. They could have had influenza, but you wanted to make sure you were capturing everybody. So you can see that, yes, there was a spike, but then once again, you're seeing that cases are leveling off, and the cases are leveling off because of our efforts to keep things, the infection control efforts, such as hand washing, personal protective equipment, all that stuff that's happening in the hospitals. Okay, so like I said, initially only cases with swab confirmation was being included, but after February the 13th, anybody coming in with suggestive symptoms and or a positive CT scan, they were being included in the cases without swab confirmation. All right, so how can I protect myself? This is a big thing. So right now, as we speak today, February the 26th, we still have an extraordinarily low risk of getting exposed, okay? So one of the biggest things you can do right now is avoiding non-essential travel to mainland China and other hot zones. And that right now includes places like South Korea. Singapore has all of a sudden, the outbreak has been curbed so far. Then we have Italy now, Iran. Hand washing is important, not just for coronavirus, but any of these respiratory viruses, including influenza. So this is including things like alcohol hand foam, but also soap and water. And try to wash your hands often, and try to avoid touching your mouth and nose. Masks are not helpful in public places. This is a common question that I get. You see people wearing masks We unfortunately had a situation where people were taking masks from our hospitals. The reason these don't work is that they work in hospital because we're constantly changing them when we go from person to person. But people can't do that. You end up having a mask that's getting old. You're getting all these droplets on it. So paradoxically, you may be increasing your risk and other people's risk. So masks are not really a big thing. And the hand washing, avoiding public if you are feeling ill, and if you are ill, if you're feeling ill, not going out into public, and of course avoiding sick people. Vaccinated, this is something for influenza, but there may be a vaccine at some point for coronavirus. It's just not there yet. Okay, but the reason I bring all this up, these are kind of general things that we do for respiratory viruses, and still to date, it's an extraordinarily low risk. The other big thing to consider is that the hospital location, the healthcare places, are where we have to have the most ways of protecting us, and that's why we have these protocols set in place to early identify these people that are coming in, diagnose them, and then get them into isolation, whether that's in the hospital or more commonly at home. So here are the proper hand washing techniques, okay? And I'm sure that we've all seen this somewhere. Generally, you wet your hands under warm water, you put the soap there, and you make sure that the rubbing aspect of the hand washing is the most important. And you want to get your entire hand, all the areas of your hand, and do it for at least 20 seconds. And often in the hospital, we are telling people to do it for at least 30 seconds. Then you rinse thoroughly, and you want to wipe your hands with a disposable, like a paper towel. And we often will also say is to use that paper towel to turn off the tap. That's the best way to do it. Okay, so right now that's kind of a whirlwind overview of coronavirus. And now I'll happily take any questions because I'm sure there's lots of them.
Yeah, that's great. Thank you. So some of the questions that we got ahead of time that I just want to run through. So what precautions, if any, should we take on receiving shipments from China, i.e. online orders from Amazon?
Yeah, this is actually a surprisingly common question. And in this situation, I think that it's very, very unlikely to need any special precautions. The thing is that while we do know things like influenza, they can last on surfaces for, about 12, maybe at most 48 hours. It has not seemed to be the case for coronavirus. I don't want to make a complete value yet. We don't know exactly, but we think that if coronavirus is anything like other coronaviruses, it doesn't really last on surfaces for very long, and you don't really have to worry about things coming from China.
Okay, great. If someone just came back from one of the Asian countries, would a swab test alone let someone know if they've contracted the virus?
The answer is possibly. So it's much more likely that if you have symptoms that the virus can be diagnosed. The problem is that there's people that can come that if you don't have symptoms, you're less likely to have a positive swab, but later on the swab can become positive. So if you do come back from an Asian country, what we're asking people to do, that if you feel unwell, you basically stay at home, and you can call the emergency department before you go if you have a fever to let them know you're coming, and then you get put in straight into isolation, and they can do the swab there. But the swab is the gold standard that we have for diagnosis of coronavirus.
Okay. And how long is the virus active outside of the body, for example, after sneezing or coughing?
So we don't have the full data on that yet, but it looks like the preliminary stuff is showing no more than 12 to 24 hours. It doesn't stay on surfaces for several days like certain other viruses can.
Okay. When traveling by airport, what are some of the precautions we should take?
This is a very common question as well, and the problem is you can't really do much. I mean, you can wash your hands, of course. You can avoid the hot spots. So, like, if you're going to go to an airport in China, in mainland China, the risk there is going to be much higher than, say, an airport in Dominican Republic. So, the big things is hand washing, and again, I do say is avoiding the area as much more. Avoiding airports in the hot zones is much more protective than, say, wearing a mask, because as I told you, the masks can paradoxically make things worse.
Okay. So what is the best way to implement prevention in the workplace?
In the workplace, again, I think the big thing is what you guys are going to be seeing this thing called social distancing. If we start to see a lot more cases, one of the things the CDC recommends is something called social distancing. So, for example, if you feel sick, don't come to work. Occasionally, certain types of meetings would be canceled, mass gatherings would be canceled. But at work, again, I know I sound like a broken record, but the best things to do is to wash your hands, avoid touching your mouth and nose, and if you're feeling sick, don't report it to your supervisor and don't show up to work.
Right. For hand washing, is paper towel better than hand dryers?
Yes. So here's an interesting thing. So hand dryers have been shown, I mean, I'm not saying they don't work, but they have been shown to sometimes that if you have let's say if you didn't wash your hands completely 100% properly, that the hand dryers can actually make droplets and then spray everything. So that's why paper towels are better to use and also to use to help turn off the sink.
So although hand washing is clearly the best defense, if you touch a washroom handle after you've washed your hands, would you recommend using Purell after you touch the handle as a best practice?
You could. I should actually mention that too. Yeah, of course. So you can use like an alcohol hand rinse as well. That has one advantage that you can kind of keep it at your desk. So let's say if you touch something, I often talk about touching like what we call the infectious hot zone. So not coronavirus hot zone, but like bacteria hot zones. Elevator buttons, doorknobs, certain areas on your desk that you touch very often. So if you have come back from another floor, you've touched an elevator button, sure, use alcohol hand rinse because that is easier to do.
And is hand sanitizer as effective as washing your hands?
They're equal, actually. They work. Now, not for every infection. So, for example, this doesn't apply to viruses. In a hospital, there are certain infections, such as Clostridium difficile, that we recommend using hand wash because we recommend using hand wash in water and soap because if you use the alcohol stuff, it can actually make things worse. But for the most part with viruses, using hand wash, alcohol hand rinse, or in water is just as effective.
And what is the difference between sanitizing and disinfecting?
Actually, this is, I think, a technical definition. So I'll defer the answer to this question because I don't know. But what we will say, like, for example, in terms of sanitizing when they do for rooms, it's a chemical approach of what types of chemicals that they can use to completely sterilize surfaces that are high traffic. But beyond that, that's a bit beyond my expertise.
Should retired people stock up on food, water, etc., and stay home or out of the public for the next month or so?
Yeah, this is actually a common question I get as well. And right now, I will say no. I don't think, even if we do start to see more and more cases in Canada, this is somewhat more serious than just a flu outbreak, but it's not going to be like SARS. We do basically know that the virus that we're seeing is not as virulent as SARS. So I would say for now, the answer to that question is no.
Okay. This person has a trip planned for mid-March to go to Italy. Do you think it's safe with it being the new hotspot?
I would say I don't know, but with a caveat. So this is a hotspot, and the thing is, we don't exactly know because all of Italy is not going to be the same. The hotspots are different, whether it's Milan versus the south. What I often say is that because we do have a potential for a lot more cases to appear in Italy, I would say to avoid non-essential travel. This could change in the next couple of weeks, but for now, if it's March, this is probably going to be in the uptick of cases. So if it were me, I would avoid it. But everybody has their own risk tolerance. But in terms of China, even with China, as it being a major hot zone, people can still go there. It's just that it's a hot zone, so you want to avoid it if you can. And that's the main thing we've been recommending.
The incubation period is how many days for this virus?
So the average incubation period, it can vary. We've seen it as quick as 3 days. We've seen it as long as 10 days. There are reports that are flying around. I see some theories of people saying it's up to 28 days, and that's not what's been borne out in practice. So on average, about a week. And that's part of the reason why I was mentioning at the beginning, we keep the quarantines to be just double that, so we give ourselves a buffer.
In general, is there anything special that housekeeping departments should do?
And not with this, no, because again, housekeeping departments, I would say within a hospital, maybe, because if you're going to be in a room right after somebody was discharged from there with coronavirus, it's a little bit different. They're going to have different protocols, but for in general, outside of the hospital, there should be no difference.
Somebody's going to the Bahamas in a couple of weeks. What precautions should she take on the plane?
In this situation, I would say nothing apart from the universal precautions. So, broken record here, hand washing, don't touch your mouth and nose. I would not use a mask.
Okay. So that actually brings to this point. When flying on an airplane to Asia, would you recommend wearing the mask?
Again, so the mask is not going to really help much. And the thing is that now, theoretically, if you can get a mask, if you're sitting next to somebody who's coughing and sneezing, you know, again, the risk of them having coronavirus is quite low. So it's very, very hard to quantify in this situation. The other thing I want to tell you is, remember during flu season, okay, we are at much higher risk of getting influenza than coronavirus. And influenza can be just as dangerous, but you don't see people walking around with masks all the time. So the risk of getting influenza on a plane is much higher than coronavirus, and usually people aren't wearing masks. So hand washing.
Okay.
Don't touch your mouth and nose.
Yeah. When do you predict this virus will ease off?
That's a very good question. So again, I can't say anything definitively, but one thing we're starting to see is that the cases in China are peaking, okay? And yeah, it's starting to level off. I estimate that within about 2 months, you're going to start to see that the peak is gone, but don't quote me on that, okay? And also, I am not surprised that we're seeing, because we saw the explosion of cases in China and then starting to level off, and now we're seeing it roughly 2 to 3 weeks later outside of the world, which makes sense if you think about flight patterns and the incubation period. So I think what we're now going to be seeing is that as China starts to level off, we're now going to be seeing more cases outside, and then those will level off as well.
Okay. Has SARS mutated into SARS-CoV-2?
Oh, that's a good question. No, I don't think so. But what we have seen is that garden variety coronaviruses, like that we've all gotten in the past, because they've been bouncing back and forth in China between animals and humans, that is a mutation. But now we have this virus that's a mutated. This virus is not going to now mutate and turn into something else. This is a mutated form of a previous coronavirus.
Okay. Is it true that alcohol sanitizers also kill the good bacteria on your hands?
Yes, yeah, that's a big thing, and that's why now you have to kind of in the healthcare setting, you have to kind of balance between that and all the other bad stuff that are on your hands. But you can see certain people that they paradoxically, because it's killing good bacteria, you can then get colonized with something and then get things like boils on your skin. But at the current time, with influenza going around, I think that the risk of using alcohol hand rinse is much outweighed by the benefit.
Okay. Would more hand sanitizer stations be helpful in hotel lobbies for staff and patrons?
Yes, I think in general, maybe, because not specifically for coronavirus. For influenza, other things like rhinovirus, these things are all circulating right now. Yeah, I think that would. The only problem with them is that you can get like a mess on the wall and on the floor in front of it. But that said, I think that it would be helpful. I think that what I suggest to my my colleagues and friends is to just buy a personal one and carry it around with you.
Do you think the cases will level off after flu season?
Oh, I think it may coincide with that, because one of the theories is that coronavirus may end up becoming one of the circulating viruses. So you know how swine flu, or H1N1, came out in 2009, and now it's just like a kind of a circulating virus once a year. That might be what happens with coronavirus as well. Very, very possible. I don't know, and nobody knows until the next couple of months.
Okay. We do have lots of questions coming in. This is really great, and thank you for your participation. We're just going to have a couple more answered because we are running out of time. And any other questions that aren't answered, we can follow up with an email.
Yeah, for sure. Absolutely.
So I've heard children are less affected. Is this true?
This seems to be curiously the case. And I think the part of the reason is that, like with coronaviruses in general, they affect children and healthy people, more mildly. So this could be why. This was not the case with H1N1 when it came out in 2009. The kids were getting very badly affected by that. So I do think that this is the general trend that we're seeing. Not that young people haven't been affected by this, but in general, young, healthy people and children don't get that sick from it.
Can the virus be transmitted to food and ingesting it?
You know what? Theoretically, yes. So like if somebody coughed on your you coughed on your burger and then you ate it right afterwards, theoretically, because this, just like many other respiratory viruses, can affect the GI tract. So early studies in China showed that it can be found in stool, the virus. So theoretically, yes, but it certainly is not the primary way of transmitting it. It's just coughing and sneezing.
Okay. Will using Purell kill off the chance of catching a virus?
Well, it reduces the chance. It's very difficult to completely always eliminate it. The viruses are everywhere, right, in general, but it does significantly reduce the chance.
Okay. And how about using public washrooms or toilets in the workplace? Can it be contracted that way?
Again, like influenza can hang out on counters and stuff like that. It doesn't look like SARS-CoV-2 can do that as easily. But again, I think that we all know after we use the bathroom, you wash your hands anyway, right? So that kind of is a bit of a moot point.
Yeah. So just a couple more questions
Sure.
here. Are towels in the gym safe to use?
Oh, yeah. I mean, ones that have been washed, I think so, yes. Yeah, it's not going to, I mean, hopefully the ones that you're using are clean and washed, but in general, yes.
And to wrap it up, is there anything else offices or workplaces should be doing?
I think the big thing for the office workplace that if we start to see a lot of cases, kind of for employers to know that, listen, if somebody's feeling sick with a fever and we're seeing more cases, then don't come into work, especially if you've been to one of the hot zones. And also maybe ensuring employees get hand rinse or encouraging hand washing. That's the big thing.
Great. Thank you very much for today's call, and thank you for everybody's participation. I think it was a well-received webinar today.
Thank you.
If there are any further questions, please feel free to email us, and we can follow it up with some answers.
Thank you. Thank you so much for having me.
Thank you.